All right, today we're going to decode one of the most misunderstood and frankly fascinating conditions in all of neurology, the migraine. And trust me, this is so much more than just a bad headache. We're going to get right into the neurological cascade, from those mysterious early warnings all the way to the revolutionary treatments that are changing lives. So whether you're deep in study for your medical exams or you're just captivated by how the brain works, you are in exactly the right place.
Okay, let's just get this out of the way right now. As our source material points out, a migraine is not just a headache. It's a complex, disabling neurological disorder. And it has real, sometimes devastating consequences on people's lives. Really understanding that is the first step to grasping the science we're about to unpack.
And the sheer scale of this is, well, it's staggering. We're talking about 15% of the general population. I mean, think about that. In any room of 10 people, there's a good chance at least one of them suffers from migraines. It is one of the most common neurological conditions on the entire planet, and yet it's so often dismissed.
And it's not just about how common it is, right? It's the impact. Globally, it's the 6th leading cause of years lost to disability. And for young women, it's the #1 cause. This isn't just a day off work. This is a condition that can seriously disrupt people's lives during their most productive years.
Okay, so here's our game plan. First, we're going to double down on why we need to take this seriously. Then, we'll walk through the 4 distinct phases of an attack. And as we do, we'll look inside the migraine brain to see what's actually happening. From there, we'll see how that knowledge leads to a diagnosis, and finally, we'll get into the really exciting new era of treatment.
So, we've set the stage. We know this is a huge deal with a massive impact. Now, let's get into the science of what a migraine attack actually is.
To really get what a migraine is, you can't think of it as a single event. It's more like a 4-act play that unfolds in the brain. It has a beginning, a middle, and an end, and it can last for hours or, in some cases, even days. So here are the 4 acts in our play. It all starts with the prodrome. These are the subtle warning signs. Then, for about a third of people, you get the aura. Act 3 is the main event, the headache itself. And even when the pain finally stops, there's a final act, the postdrome, which people call the migraine hangover. This 4-part structure is literally our roadmap to the science.
And this is where things get really, really cool. Because we can now map each of these phases, each of these experiences, to specific, measurable events happening inside the brain. We're going way beyond just symptoms now. We're looking at the actual science behind them.
So it all kicks off with the prodrome, sometimes a full day or two before the headache even hits. People might feel fatigued, get a stiff neck, have mood swings, brain fog, even weird food cravings. For so many people, these are the unmistakable signs that an attack is on its way.
And what's happening here? Well, brain scans give us a massive clue. The hypothalamus, which is kind of like the brain's master regulator for things like sleep, appetite, and body temperature, it actually lights up during this early phase. This is a huge discovery, suggesting the hypothalamus might be the trigger that kicks off the whole cascade.
Next up, for about a third of people with migraine, is the aura. These are temporary, but often bizarre neurological symptoms. Most of the time they're visual. We're talking about things like flashing lights, these weird shimmering zigzag lines, or even blind spots. But they can also be sensory, like a tingling that slowly spreads, or they can even mess with your speech.
The culprit behind the aura is a phenomenon with a wild name: cortical spreading depression. Just picture a slow-motion wave of electrical activity that ripples across the surface of the brain. Now, get this. This wave moves at only 2 to 6 millimeters per minute. I mean, it's incredibly slow. And that's the key. That slow crawl is exactly why the aura symptoms seem to march or evolve gradually over several minutes. The biology perfectly explains the experience.
And then comes Act 3, the headache. This is the part everyone knows about. It's usually a severe, throbbing pain, typically on one side of the head, and it can last for hours or even days. And it's almost always joined by other horrible symptoms, like nausea, vomiting, and this extreme sensitivity to light and sound that forces people into a dark, quiet room. So where does that awful pain come from? It all starts with something called the trigeminal-vascular system. Think of it as the head's internal alarm system. The trigeminal nerve, a huge nerve in your head, gets activated and releases a cocktail of inflammatory chemicals, these neuropeptides, around the blood vessels in the brain's lining. That is what generates the intense, throbbing pain of a migraine. But even when the pain finally goes away, the attack isn't over. The last phase is the postdrome, the so-called migraine hangover.
People feel wiped out, they can't concentrate, their neck is stiff, and this can last for another day or so. And this isn't just someone feeling tired after a rough headache. Brain scans actually confirm that this is a real, measurable phase where brain function is still altered. Okay, so now that we know all this complex stuff happening in the brain, how do doctors actually diagnose it? Well, you might be surprised to hear that it's almost always a clinical diagnosis. It's based entirely on the patient's story and a normal neurological exam. Usually no fancy scans are needed, unless there are red flags. So to make the call, clinicians use a very specific checklist. A person has to have at least 5 attacks. Each one needs to last between 4 and 72 hours without treatment. The headache itself has to have at least 2 key features, like being one-sided or throbbing. And, this is critical, it has to come with at least one other symptom, like nausea or that intense sensitivity to light and sound. It's this level of specificity that lets you make the diagnosis confidently. But here's the question that every single clinician has to be asking themselves. Sure, migraine is common, but a headache can also be a sign of something much, much more dangerous. So, how do you tell the difference between a typical migraine and something that needs an urgent workup?
And the answer is, you have to be on high alert for red flags. These are the warning signs that something else might be going on. We're talking about things like a sudden explosive headache, what we call a thunderclap headache, or a new headache in someone over 50, or any new neurological symptom like weakness or numbness. If you see any of these, it's time to investigate further right away.
Okay, so this is where all that hard science, all that pathophysiology we just walked through really pays off. Because our deep understanding of exactly what's happening in the brain during a migraine has led to an absolute revolution in how we treat it.
And CGRP is the perfect example. It's a game changer. Scientists figured out that levels of this one key molecule, CGRP, spike during a migraine attack. So they thought, well, what if we block it? And it worked. Blocking this one molecule can stop or even prevent attacks, and this discovery led to a whole new class of drugs designed specifically for migraine. It's a beautiful example of science leading directly to a breakthrough therapy.
And the wild success with CGRP has basically blown the doors wide open for new research. Scientists are now targeting all sorts of other molecules and pathways involved in migraine, like something called PACAP and even hormonal pathways. The future of treatment is looking incredibly bright, with much more personalized and effective options just over the horizon. So let's end on this thought. This whole journey of understanding migraine has been a masterclass in decoding the brain's circuitry. We've taken a condition that was often dismissed as invisible or all in your head and given it a concrete biological basis. It really makes you wonder, as our tools get even better, what other so-called invisible conditions are next in line for their own scientific revolution.
And that's our deep dive into the science of migraine. All the information we've covered today comes from the article Migraine, Symptoms, Types, Pathophysiology, and Diagnosis in BJA Education. Thanks so much for joining us for this explainer.